In this lecture, we will look at an important venereal infection of horses, namely contagious equine metritis. It falls under theme 3.4, miscellaneous bacteria. Contagious equine metritis, or CEM, is a venereal disease of horses caused by Taylorella equigenitalis. These bacteria were reclassified. An older name you may encounter is Haemophilus equigenitalis. These bacteria are non-motile, gram-negative, short coccobacilli. They are labile outside the host and very fastidious in their growth requirements. Infection by the bacteria cause a venereal disease in mares characterized by acute endometritis, salpingitis, and or vaginitis, resulting in infertility that is usually temporary. The disease is highly contagious. Carriers, both stallions and mares, play an important role in dissemination of the disease. CEM is a controlled disease in South Africa. Taylorella equigenitalis can be found as a commensal in the genital tract of clinically healthy horses. Thoroughbreds seem to be more severely affected. Venereal transmission is most common, but the bacteria can contaminate and be transmitted by fomites and artificial insemination equipment. Mares remain carriers until they clear themselves of the infection. This could take months to years. Stallions can remain carriers indefinitely. In the stallion, there is strictly speaking no infection, as Taylorella equigenitalium colonizes predilection sites, the distal urethra, urethral fossa and sinuses, penile and preputial laminae. When transmission occurs to the mare during coitus or artificial insemination with infected semen, bacteria will migrate through the cervix to the uterus and fallopian tubes. They proliferate, leading to salpingitis, endometritis, and or vaginitis. Endometritis creates an unfavorable environment for the implantation of the embryo. Predilection sites on the external genitalia, the clitoral fossa, and sinuses can also be colonized. Mares are carriers until they can clear themselves of infection. This may take weeks or months. Successful implantation is possible, although rare. Congenitally infected foals can be born, or they can be contaminated during birth. An infertility syndrome develops after infection. Clinical signs of endometritis only develop in 30 to 40% of mares after breeding. Acute endometritis and or vaginitis will lead to a cloudy, mucopurulent vulvar discharge. Chronic infection results in a less obvious discharge that may only appear 80 days after infection. Abortions are rare, but abortion storms can occur. Sampling for this disease is done with swabs. 2 sets of swabs are taken from mares to investigate clinical disease. Swabs for PCR are not placed in transport medium. PCR is more commonly used these days because bacteria do not have to be alive. Chances of detecting bacteria are therefore much better. If culture is the only option, swabs must be placed in transport medium with activated charcoal and transported on ice. Swabs must be processed within 48 hours because the bacteria is so labile. Samples of the placenta and fetus can be submitted for culture or PCR. Taylorella equigenitalis can be present even if it didn't cause the abortion. These are the different sites that are swabbed. 1 swab for each site. Infected horses must be either isolated and treated or euthanized. In South Africa, there is a protocol for treatment. Intrauterine irrigation with penicillin or ceftiofur is performed to treat endometritis. Treatment of external genitalia of mares and stallions is prescribed. It is thoroughly cleaned for 7 consecutive days with 5% eucosate sodium, which is a surfactant, followed by 2% chlorhexidine soap. Then the area is packed with an antibacterial ointment such as silver sulfadiazine or nitrofurazone. Dry cow intramammary remedy is introduced into clitoral and urethral sinuses. Swabs must be taken every day before treatment. Negative results on 3 consecutive days are taken as an indication that treatment may be discontinued. Another 2 sets of swabs are tested 21 and 28 days after the end of treatment to confirm the success of treatment. Prevention and control of this disease relies heavily on quarantine and testing. All imported horses older than 2 years from countries not free of CEM have to be quarantined and tested. In addition, the first 3 mares bred to an important stallion can be quarantined and tested because false negative results are possible when testing stallions. These stallions are identified when the mares they serve become positive. CEM positive horses must not be bred until testing provides evidence that they are cured. Continued vigilance is required in any of the horses in the categories above. They must be tested prior to resale, and abortions have to be investigated. Strict hygiene is required when handling mares and stallions. Wear disposable gloves and change gloves between horses. Instruments need to be properly cleaned and disinfected between animals. CEM is a controlled disease in South Africa, which means that the state vet has to be informed of a positive result. The first case was confirmed in April 2011. Surveillance forms a large part of the control of this disease. A veterinary procedural notice was drafted with guidelines on the requirements for control. For the purpose of surveillance, testing of stallions is compulsory. They are not allowed to breed unless they have a CEM clearance certificate. Dry swabs for PCR are taken of the urethral fossa, including the urethral sinus and penile sheath. In summary, Taylorella equigenitalis causes contagious equine metritis. It is a controlled disease in South Africa. The bacteria are extremely contagious and cause an endometritis. Colonization or infection can lead to a carrier state because the bacteria can live as a commensal on the external genitalia of horses. The disease is controlled by means of quarantine and testing of swabs by PCR and or culture. Endometritis can be treated with antibiotics. A prescribed procedure in the form of a VPN is followed for quarantine, testing, and treatment.